McKesson Practice Partners Electronic Health Record for Medical Associates.
Now, this story is a little different to other stories I've told you. The other ones are all about things that happened quite a long time ago in the past. This one's from just the other day, when I was lucky enough to spend half an hour in a doctor's waiting room. It's like the first question for this story. Why the hell are doctors always late? Like 5 minutes after they start for the day, they're running late. Why do I show up on time for appointments? There's always a half-hour wait. At least this doctor's surgery has good magazines. I was passing the time by reading copies of The New Yorker.
McKesson Practice Partners Electronic Health Record enables the modern medical practice to improve quality and productivity and do more with less effort. It includes 3 powerful applications which are available individually or as a package. Practice Partner Patient Records provides a host of innovative tools to improve both office and clinical efficiency. It has a note-centric design, allowing physicians to easily enter data and update without jumping from screen to screen. It includes electronic prescribing tools to speed workflow and improve patient safety, and prescription writing with drug interaction and allergy information. Health maintenance protocols based on age, sex, disease, and medications are also included. Medical billing is also a feature of the Practice Partners system, which will improve the financial health of physician practices with a set of features designed to manage today's complex business requirements. Simultaneous patient ledgers and electronic remittance and encounter forms reduce the complexity of billing. Automatic payment posting, the ability to create fee schedules and calculate adjustments and payment portion, a real-time coding wizard, and a dashboard with alerts. All of these features will improve cash flow and workflow. The Practice Partners Appointment Scheduler provides a flexible solution for scheduling. A physician office can automatically find appointments using set criteria, as well as easily schedule with multiple providers and follow a team protocol. Repeat appointments can all be scheduled from one screen. Flexible appointment options include customizable screens, support for wave scheduling, double booking, a daily calendar, group appointments, and wait lists. A physician can also produce management reports with productivity analyses, no-shows and cancellations, and patient reminders and follow-ups. Medical Associates has a number of concerns and preferences when it comes to implementing an electronic health record, and McKesson believes Practice Partners will address each of them. Of primary concern are 3 criteria. Number 1, the EHR should enable medical associates to meet meaningful use requirements. New healthcare legislation has brought EHR to the forefront, both for its potential to reduce costs and improve quality. The government will now encourage the adoption of EHR systems through monetary incentives. Eligible providers must meet a set of 15 core objectives and 5 menu sets, such as maintaining active medication lists and up-to-date problem lists of current and active diagnoses, e-prescribing and drug interaction checks, and reporting clinical quality measures to CMS or states. All of these requirements will be met with the features of the Practice Partners Suite. In addition, Practice Partners is certified by the Certification Commission for Healthcare Information Technology. Number 2, cost is also a consideration, and McKesson has thought of physician expense in designing Practice Partners. The system may be bought as a suite, or the 3 subsystems can be purchased individually based on customer preference. Flexible options mean the upfront cost is such that Practice Partners can be implemented by small offices as well as large ones. Low maintenance fees, simplicity of use, and increased efficiency equal larger revenues, which will further offset any initial costs. The third concern Medical Associates has are workflow changes, including process changes and technical difficulties which may frustrate those new to EHRs. One of the goals of Practice Partners is simplicity. It exists to improve physician workflow and is designed to be as intuitive as possible. The many features that exist in the Practice Partners Suite allow physicians to access records, billing, and appointment tools with a small number of menus and a straightforward interface. Training times tend to be low even for those without technical expertise. We know that one of the top concerns of physicians when buying an EHR is the effect it will have on work processes, and have designed a system with that concern in mind. Return on investment is an important consideration for medical associates, and McKesson believes practice partners will be a profitable investment. Implementing an EHR carries with it a number of benefits. Level 1 tactical benefits are the most obvious and include paper reduction, staff downsizing, and smaller storage facilities. But there are other benefits as well. Level 2 process benefits include reduced charting and handoff time, patient processing improvements, and document retrieval efficiency. Level 3 enterprise benefits must also be taken into consideration and include revenue cycle benefits in the form of increased collections and reduction in denials. They also include increased customer satisfaction and market share. Costs are also factored into the ROI analysis. Direct one-time costs include hardware and software installation and initial training and maintenance. Direct future costs, such as continued training, as well as indirect costs, must be examined. After speaking to the leadership at Medical Associates about their needs, plans, and concerns, we have conducted a cash flow analysis of what we believe is a realistic scenario after you implement the Practice Partners system. For this analysis, we assumed annual inflation of 3% and a 10% cost of capital. Initial investment in year 0 will be your largest expense, with hardware and software installation and training equaling $305,000 for a negative balance of $275,000. However, we believe the system will quickly show profitability. Benefits in the form of savings and increased revenues will quickly surpass costs. Year 1 cash flows are estimated to be $360,000, increasing steadily to $437,000 in year 5. The end result is a net present value of $1,253,936 and an internal rate of return of 136%. Implementing McKesson Practice Partners will be a profitable investment for Medical Associates. Medical Associates cares about meeting meaningful use requirements and wants to take advantage of the incentives given to practices that meet them. The HITECH Act aims to address the high cost of adoption by providing physicians with federal incentives of up to $44,000 for Medicare physicians and up to $63,750 for Medicaid physicians, if they can meet the meaningful use requirements outlined in the final rule recently released by CMS. With 40 physicians at Medical Associates, this translates into big profits. The goal, then, should be to implement the system as quickly as possible. The quickest time frame would have physicians demonstrating they meaningfully use EHRs in the year 2012. We estimate the system will take 10 months to a year to fully implement. Built into the system are the requirements for all eligible provider, core requirements, and menu sets. This time frame will enable Medical Associates to take full advantage of either the Medicare or Medicaid incentive structure. Also anticipated are future changes, such as expected changes in 2011 and 2013, when menu sets become core items and new parameters are established. McKesson is committed to tracking these changes and making updates to the system as part of the Practice Partner package. This presentation was prepared by McKesson for Medical Associates.